The top stories tonight in Y News. President Rodrigo Duterte has backed out of the debate with retired Senior Associate Justice Antonio Carpio, designating presidential spokesperson Harry Roque instead.
Newly sworn-in Philippine National Police Chief General Guillermo Yazar to relaunch his internal cleansing policy among the ranks of police officers.
Additional 1.5 million doses of Sinovac vaccines arrived in Manila from Beijing today. The IATF has approved the proposal to require incoming travelers to be tested for COVID-19 on the 7th day of arrival in the Philippines.
New report sounds the alarm on the global shortage of midwives.
And a 25-year-old Malian woman gives birth to 9 babies. Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Friday, May 7, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, UNTVweb.com. I am William Theo.
First in the news. President Rodrigo Duterte will no longer face retired Associate Justice Antonio Carpio in a debate on the West Philippine Sea issue. Instead, he designates presidential spokesperson Harry Roque to face the former magistrate. Rosalie Cos will tell us why.
After challenging retired Associate Justice Antonio Carpio, President Rodrigo Duterte withdraws from the debate on the West Philippine Sea. This following the advice of some of his cabinet members and some senators. According to Malacanang, nothing good will come out if the president will face the retired magistrate. More importantly, government policies including our national security and other confidential information on the West Philippine Sea issue may be compromised if the president will participate in the debate.
Bakit papayag sa debate? Nakaupong presidente naman si Presidente Duterte at si Antonio Carpio po, Attorney Antonio Carpio, bagamat siya ay dating mahisrado, ay ordinaryong mga abogado na ngayon. Parang hindi naman po ata tabla, no? Na ang Office of the President, na Presidente mismo ay harap sa isang ordinaryong mambabatas. Parang hindi po patas.
Instead, the chief executive designates presidential spokesperson Roque to take his place. The palace official said he is prepared to face Carpio on particular issues, including who was responsible for the loss of our territories to China years ago, and if the Duterte administration is indeed dismissing the arbitral award favoring the Philippines.
Tuloy po ang debate dahil importante naman na marinig yung mga ideyas, no, para ang mga taong bayan ang makagawa ng konklusyon. Ang sabi po ni Presidente, tinatalaga niya po ang inyong abang lingkod na makipagdebate kay retired Justice Antonio Carpio.
Meanwhile, the chairman of the Board of Governors, Domingo Cayosa, appeals to public to urge the leaders and those who can contribute solutions to talk, listen, cooperate, and collaborate on the issue instead of fighting against one another. He adds those on the other side would love to see the Filipinos and our leaders divided, confused, misunderstood while bickering publicly. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, retired Supreme Court Senior Associate Justice Antonio Carpio says he is still ready to debate the factual accuracy and adverse legal implication to the Philippines of the president's claim that China is in possession of the West Philippine Sea. However, Carpio rejected the proposed topics of presidential spokesperson Harry Roque, saying it will be pointless to debate on issues surrounding the Scarborough Shoal and Mischief Reef. According to Carpio, he had accepted the challenge on the premise of President Duterte's arguments, such as that China has the whole possession of the West Philippine Sea. Several senators expressed doubt on the supposed debate between President Duterte and retired Senior Associate Justice Antonio Carpio on the West Philippine Sea issue. In a message, Senator Coco Pimentel, who also chairs the Senate Committee on Foreign Relations, said the public debate is no longer necessary for several reasons. One, it will not settle anything, and two, it will only send an impression to other nations that the country is divided on the issue. He added that Filipinos may be interested in other things that are more important to them, such as finding work. Senate President Vicente Soto III also doubts if the country will benefit from the debate. Meanwhile, Senator Panfilo Lacson believes only China will benefit from it. The lawmaker adds the hype on the debate should not distract Filipinos into allowing the Chinese to sneak into the country's territory. For its part, the Integrated Bar of the Philippines says the matter should be discussed not in a public debate, but in a private dialogue together with experts. He also noted the possible repercussions of publicly discussing the matter in the country's national security.
Kung titignan ho natin, mukhang popular yun. Entertaining, nakakatuwa, may kanya-kanyang manok, may kanya-kanyang mga tagapalakpak. Pero yan ba ang pinakamagandang gawin para sa ikabubuti ng ating bansa? Siguro aabot tayo dyan sa debate, but at this point, what we would want to suggest to all of them, with due respect, maghinay-hinay, mag-usap in private at magtulungan para iisa ang ating tututukan na approach.
IABP President Attorney Domingo Cayosa calls for national unity in taking a stand on the West Philippine issue against China, which he described as a big adversary.
Sino ang tuwang-tuwa dyan? Di siyempre yung kalaban natin. Tuwang-tuwa sila sapagat lalong nagkakaroon ng hidwaan ang ating bansa.
Meanwhile, experts believe that politics and contradicting positions over the West Philippine Sea are the roots of the dispute between President Rodrigo Duterte and retired Supreme Court Justice Antonio Carpio. Dante Amento tells us why.
Retired Supreme Court Justice Antonio Carpio asserts that the Philippines possesses the West Philippine Sea. In fact, he is among those who pushed to go to the International Tribunal to file a complaint against China, which the Philippines won in 2016. But President Duterte, on the other hand, stresses the award is just a paper and it will result to war if we insist China to give up the disputed area. UP Professor Clarita Carlos says the contradicting positions of Duterte and Carpio are the main roots of dispute between them, and that the chief executive is right over his position on the 2016 arbitral award, and we cannot take back the disputed area without the use of force.
Tignan mo din sa United Nations, ang dami-daming resolution supported by ng Security Council ng Big Five. Palagi mo ba, nasusunod itong mga resolution na to? Hindi. Ganyan talaga yung international politics. Kung meron kang pwersa, di isulong mo kung ano yung maisusuporta ng pwersa mo.
But Professor Tony Lavinia also believes that President Duterte should be blamed because he did not stand for our sovereignty and right.
Instead of aminin niya na mali siya, tiniturn around niya. Sinabi niya kayo may kasalanan. Definitely walang kasalanan si Justice Carpio. He was a Supreme Court Justice when yung Scarborough Shoal was taken over by China.
Political analyst Ramon Casiple has disclosed that aside from the West Philippine Sea, politics is one of the reasons why former Justice Carpio had made several statements against the president. He even launched a Sambayan group to create an opposition slate in the 2022 elections against the Duterte administration candidates.
Malamang sa hindi, ang kanilang susuportahan ay hindi yung kandidato ni presidente. So may elemento na yan ng electoral na bangayan,
Meanwhile, Professor Carlos adds it is just a waste of time to pursue the debate between the president and Carpio.
Merong mga ibang nagsasabi na gusto nila magkaalaman. Pwede mo rin malaman yan, magkalkal ka ng sarili mo kasaysayan, di ba? So wag na lang tayo mag-aktaya ng panahon dyan, ng panahon nilang dalawa.
The most important thing is to unite and make necessary effort for China to realize and withdraw from occupying our territory at the West Philippine Sea. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Department of Foreign Affairs Secretary Teodoro Locsin Jr. insists that the 2016 Hague ruling did not order China to leave the West Philippine Sea. Meanwhile, a security expert says that President Rodrigo Duterte prefers direct negotiations with other claimant countries in the West Philippine Sea. Nel Maribuhok will tell us why.
The 2016 Hague ruling rejects only the basis of China to claim the West Philippine Sea. In his Twitter post, the Foreign Affairs Secretary Teodoro Locsin Jr. said the arbitral ruling does not pronounce about sovereignty. It only describes the features and the jurisdiction of the country. Locsin said that under the said ruling, it did not order China to leave the West Philippine Sea. Like any other international bodies, it has no enforcement capability. Also, the Secretary emphasized that the only body that can kick another country out of its territory is the one whose territory was taken. The statement of the SFA follows the pronouncement of former Foreign Affairs Secretary Albert Del Rosario that it's a national tragedy that the President takes the side of China and believes that the ruling is a scrap of paper meant to be thrown to waste. According to Professor Romel Banlawi, a security analyst and international studies expert, the President did not mention about neglecting the West Philippine Sea dispute. Banlawi believes that the President just wants to focus on direct negotiations with claimant countries in the West Philippine Sea.
Kasi si Pangulong Duterte, napaka-pragmatikong tao yan at isa sa mga nakikita niyang pragmatic approaches ay yung direct consultations with all parties in the territorial and maritime front.
In fact, the administration pushes for the joint cooperation to other countries in Asia.
Isa sa mga sinusulong niya ngayon yung tinatawag na functional cooperation. Sa halip na pag-awayan yung mga teritoryo o mga maritime areas sa South China Sea ay magtulungan sa pamamagitan ng marine environmental protection, marine scientific research, joint fishery management, law enforcement cooperation, search and rescue operations, at very lately, yung controversial na joint development of natural gas and oil.
President Duterte already said that he will defend the country's sovereignty. This is amid the criticism of being reluctant to confront China over the issue on the West Philippine Sea. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, newly sworn-in Philippine National Police Chief Lieutenant General Guillermo Eleazar will relaunch his internal cleansing policy among the ranks of police officers. Leah Ilagan will tell us why.
PNP Chief Police General Guillermo Lorenzo Tolentino Eleazar has formally taken charge as the 26th Chief of the Philippine National Police. During his first speech at the turnover ceremony held in Camp Crame, General Eleazar said he will focus on cleaning their rank through the program Intensified Cleanliness Policy. Eleazar will continue the police thrust to fight illegal drugs and terrorism. The new PNP chief also orders the arrest of those who do not wear face masks. General Eleazar said the use of quick response or QR codes for the application of all police officers nationwide will be implemented to end the Padrino system.
Only the best for the PNP, only the best for the Filipino people. Ngayon pa lang, humingi na ako ng pasensya at pamanhin sa mga gustong makiusap sa mga kasamahan natin sa PNP, sa mga retired senior police officers, sa aking mga kamag-anak at mga kaibigan. Pasensyahan na po, tatablahin ko kayo.
For his 6 months term, Eleazar vowed to win the public's trust.
I also signed a contract with the Filipino people that I too shall lead by example. It is in this contract that I assure our kababayan that for as long I am the Chief PNP, every single centavo of your hard-earned money allocated to us will be in good hands.
And ensure to be a good and clean leader of the Philippine National Police.
Nakamit ko na ang isang pambihirang pangarap o ilusyon ng bawat pulis, ang maging Chief PNP. Bakit pa ako lilihis sa landas?
Meanwhile, DILG Secretary Eduardo Año admired former PNP Chief General Leopoldo Sinas for his diligent work even though it was full of controversy. Secretary Año also confirmed that President Duterte will also give Sinas a new position. Secretary Año also reminded General Eleazar not to exchange his integrity for temporary satisfaction. He says there is no equivalent to having a clean conscience and a respectful name. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
For those watching us on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook.
1.5 million doses of Sinovac vaccines from China arrived today in the Philippines. The bulk shipment is expected to boost the government's vaccination program. Asher Kadapan Jr. details why.
The National Task Force Against COVID-19 prioritizes the vaccination rollout in areas considered as COVID-19 hotspots to help the community with its battle against the deadly virus. With this, the government intends to distribute the bulk of 1.5 million doses of Sinovac vaccines that the country received today to the priority areas. These include the National Capital Region, where 800,000 doses were allocated. Its adjacent provinces including Bulacan, Cavite, Laguna, and Rizal will also receive more supply from the new batch of the Chinese-made pharmaceuticals.
Pinag-uusapan natin dito mga 750,000 lives, no? That we can protect against severe COVID infection and thereby preventing hospitalization and preventing deaths, no?
Despite the prioritization in the vaccination distribution, Vaccine Czar and NTF Chief Implementer Secretary Carlito Galvez Jr. reassures that no local government unit will be left out.
Wala tayong iiwanan. Ang ano lang natin, i-accelerate lang muna natin ang Manila because we are racing against time para bumaba ang kaso.
Most COVID-19 vaccines were delivered from Sinovac, which now reached to as much as 5 million doses. Secretary Galvez says more supplies will be delivered, totaling 7 million doses this month and about 10 million in June. 2 million doses of AstraZeneca vaccine is set to be delivered tomorrow, while another 193,000 doses has already been scheduled to arrive on May 11. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health, or DOH, announced the official resumption of the Oxford AstraZeneca COVID-19 vaccine administration for all eligible populations in the Philippines. The DOH previously suspended the use of AstraZeneca vaccines following the recommendation of the local Food and Drug Administration, or FDA, to temporarily halt its use on persons below 60 years of age after reports of very rare cases of blood clots. The DOH, however, said that specific guidelines and measures will still be enforced to mitigate the risks of vaccination.
The Department of Health's protocol of using a single brand of COVID-19 vaccine for the first and second dose remains. According to the DOH, President Duterte should still receive the Sinopharm vaccine for his second dose. Aiko Miguel reports why.
Based on the assessment of the Department of Health and Vaccine Expert Panel, there should be a more vast scientific study before implementing mix and match of COVID-19 vaccines in the Philippines. According to Undersecretary Maria Rosario Vergere, they cannot compromise the safety and health of Filipinos, given that there is no enough evidence that COVID-19 vaccines of different brands can be mixed and used together.
Sa ngayon, ang ating protocol, single brand muna po tayo. So kung pag binigyan tayo ng Sinovac sa umpisa, Sinovac pa rin ang ating second dose kasi wala pa po tayong sufficient scientific evidence to state that we can already mix brands.
Currently, it is only the United Kingdom that has been conducting a clinical trial of mix and match of vaccines. That is why the DOH recommends that Sinopharm should still be given to President Duterte for his second dose. They are strictly monitoring the condition of President Duterte after receiving his first dose of China's COVID-19 vaccine Sinopharm.
Of course, he's the president, no? So we will monitor him every day about regarding this adverse event. He has to be taken care of also by the Department of Health. Kung pag-uusapan po ang liability, it is a compassionate special permit, and based from the compassionate special permit conditions na klaro naman po iyon sa mga nag-apply nito, yun pong ospital o kaya yung doktor na nag-apply nitong compassionate special permit is accountable.
The DOH reminds the public there are no authorized vaccines in the Philippines available now aside from the COVID-19 vaccines of Sinovac, AstraZeneca, and Sputnik V. Next month, the supply of Moderna COVID-19 vaccines will arrive in the country as it has been granted with emergency use authorization on Wednesday. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Pasay City local government has opened the first Giga vaccination hub in the country despite of the shortage of vaccine supplies. JP Nunez will tell us why.
The COVID vaccine supply of the Pasay City government is now limited as they are also depending on their supplies to the national government. But the city assures their residents that they are already prepared to conduct a massive vaccination to the general public as they open the Giga vaccination facility in Mall of Asia Arena. Pasay Mayor Emmy Calixto Rubiano says the center can cater up to 2,000 vaccinees per day.
Nagkaroon po kami talaga ng partnership at ito po yung Galleon Museum na talagang malaki at pwedeng paggawan ng ganito pong Giga Vaccination Center at mas safe din kung makikita niyo yung ceiling, sobrang taas, ang laki-laki ng space para po maging safe din ang mga mamamayan.
The area is spacious and fitted with an air conditioning system which ensures that proper health and safety protocols are followed. The vaccination hub also has a drive-through vaccination area. According to the Department of Health, Pasay's Giga Vaccination Facility is now the largest vaccination facility in the Philippines.
Harinawa lahat ng mga malls ng SM ay buksan natin para magkaroon po tayo ng mga ganitong magandang vaccination mega. Hindi lang siya mega, giga. Alam nyo, ibig sabihin ng giga, gigantic. So ito po talaga ang laki-laki ng lugar na kung saan natin gagawin ang bakunahan para po sa atin mga senior citizens.
A total of 25,137 Pasay residents received the first dose of COVID-19 vaccine. Rubiano also reported that there has been a decrease in the daily COVID-19 cases recorded in Pasay City, from around 1,000 to only 100 cases daily. She reiterated the need to abide by the health and safety protocol despite the lowering of cases. JP Nunez, UNTV News and Rescue. We serve the people. We give glory to God.
More than 1 million individuals have already recovered from COVID-19. The Department of Health reported 4,227 new COVID-19 survivors, raising the tally of recoveries to 1,003,160. The DOH also reported 7,733 additional cases nationwide, bringing the total to 1,087,885. The death count also increased to 18,099 after the DOH recorded 100 new fatalities. The total number of active cases went up to 66,626. Majority of the active cases, or 94.4%, have mild symptoms. 2% were asymptomatic. 1.5% have severe symptoms, while 1.1% were in critical condition.
The Interagency Task Force against COVID-19 has allowed 15 to 17 years old, as well as those 65 years old above, to leave their homes to register for the Philippine Identification System. Strict community quarantine directs those below 18 years old and 65 years old above to stay at home except to access essential goods and services. The Philippine Statistics Authority targets to register 28 million Filipinos for the national ID.
Ang mga minor de edad, 15 to 17, kasama rin po ang mga seniors, yung mga above 65, palalabasin lang po ng kanilang mga tahanan para po magrehistro sa Philippine Identification System. At syempre po, yung dating rule na kapag kinakailangan para kumuha ng mga essentials o kailangan para magtrabaho, hindi po yun apektabo.
Global agencies call on governments to fully invest in professionally educated and regulated midwives. Nina Armilio tells us why.
A new report warns of a global shortage of 900,000 midwives. This number represents 1/3 of the required midwifery workforce worldwide. Now, global agencies like the World Health Organization, the United Nations Population Fund, International Confederation of Midwives, and their partners call for investing in midwives. In unison, they say that fully investing in midwives by 2035 would avert roughly 2/3 of maternal, newborn deaths, and stillbirths. That would mean saving 4.3 million lives per year. Natalia Kanem, Executive Director of the UN Population Fund, or UNFPA, highlighted the true value of midwives.
A capable, well-trained midwife can have an enormous impact on childbearing women and their families, an impact that's often passed on from one generation to the next.
Midwives are essential providers of health care, especially for women who are instruments in bringing to the world new lives. And this is part of why Kanem said governments around the world should invest in professionally educated and regulated midwives, according to the landmark State of the World's Midwifery Report presented on May 5th, the International Day of the Midwife.
Universal access to midwifery could save at least 4 million lives every year by 2035. Second, midwifery puts safe, effective, and respectful care within the reach of even the hardest to reach women and families. Number 3, midwifery contributes to women's empowerment and gender equality. And number 4, midwifery contributes significantly to national and local economies.
As our eyes have seen, our essential healthcare workers, such as midwives, have also been affected by the COVID-19 pandemic. Adding to that, the loss of thousands of healthcare providers in many countries battling the invisible enemy. Such happened in Liberia during the 2014-2015 Ebola outbreak, when over 400 healthcare workers, including midwives, lost their lives helping others. Nina Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
The Philippine government will implement revised testing protocols concerning incoming travelers. These will be carried out at the soonest time possible. Aiko Miguel explains why.
To prevent the entry of more variants of coronavirus disease 2019 in the Philippines, stricter border control must be enforced. Now, concerned government bodies will be drafting revised protocols on testing travelers coming into the country for COVID-19 infection. Those protocols would include COVID-19 testing on the 7th day in isolation of an incoming traveler. Experts say that is when the virus load of an infected person is high. The Philippine government has also decided to implement a complete 10-day quarantine period at the national level. Meanwhile, the DOH requests that the remaining 4 days to satisfy the 14-day quarantine period be spent at the local level.
So this is a process na para ma-ensure natin that even though nakakapasok pa rin ang mga ibang travelers, especially Filipinos sa ating bansa, nasisiguro po natin na naka-quarantine natin sila na maayos o na-isolate natin sila maayos to break the chain of transmission.
Also, to prevent the entry of the B.1.617 COVID-19 variant first discovered in India into our borders, the government has earlier banned incoming travelers from India, Nepal, Pakistan, Bangladesh, and Sri Lanka. The Department of Health is keeping track of the situation in 21 countries where the B.1.617 variant has been detected. This variant, however, is not yet classified by the World Health Organization as a variant of concern. The DOH assures it is monitoring the B.1.617 variant, along with all other variants, to ensure immediate and appropriate response. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Metropolitan Manila Development Authority, or MMDA, has re-implemented its heat stroke brake policy for its traffic enforcers and street sweepers. Marvin Calas reports why.
Aling Rita, a street sweeper, starts early on cleaning the EDSA Quezon Avenue area. One of her biggest challenge at work is the soaring temperature along the highway, especially this summer season.
Pag ganito yung trabaho namin, nag-uumpisa kami ng hindi pa mainit. Tapos, pag halimbawa mainit na, nagre-relax na. Na-stop muna ng mga ilan minuto. Tapos, pag sobra na ang init, di ko na inaano yan, di ko nag-grab magtrabaho. Pinapahinga na.
The same experience is feared by Erwin Calixto, a traffic law enforcer who's worried about having a heat stroke amid the high temperature packaged in his line of work.
Pagka sa matinding init po sir, lalong-lalo na sa trabaho po namin, medyo mahirap po talaga. Pagka ganyan sir, sobrang init, tumatabi po ako sir. Talagang iwas heat stroke na rin po. Lalo po ngayon, summer, matindi po ang init. Talagang maiwasan po na tumabi tayo.
In line with this, the MMDA re-implemented its 30-minute heat stroke brake policy dedicated for their field personnel. In a statement, MMDA Chairman Benhur Abalos says the department's main concern are its field personnel, such as street sweepers and traffic law enforcers, who are by practice exposed under the heat of the sun at work. For traffic law enforcers on duty from 5 a.m. to 1 p.m., they may take a break from 10 to 10:30 or 10:30 to 11 a.m. Those having schedules from 1 p.m. to 9 p.m., they may rest from 2:30 to 3 p.m. or 3:30 to 4 p.m. And for street sweepers on duty from 11 a.m. to 7 p.m., they may have breaks within 2:30 to 3:30 p.m.
Malaki po. Napakalaking tulong po sa amin nun. Gawa na po nung sobrang init. Bibigyan mo kami ng pagkakataon na makapag-relax. Yung sa katawan po namin, kahit pa paano po, malaking tulong po makainom po kami ng tubig sa trabaho po namin. Ay lang po yung kasangga po namin.
Opo. Yung nakaka-relax, yung umuupo kami, tapos yung nagiinom ng tubig, nagme-merienda, nagpapaypay, yung relaxation namin ng katawan.
Pag-asa reported that 18 provinces in the country recorded yesterday a dangerous level heat index as high as 41 to 47 degrees Celsius. Aside from a special 30-minute break, another 15-minute break is given to field personnel in case the temperature in Metro Manila reaches a 40 degrees Celsius heat index or higher. Pag-asa earlier warned that as temperature reaches 40 to 54 degrees Celsius, heat cramps and heat exhaustion may be felt by a person that may also lead to having a heat stroke. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, India's government is now commanded to provide more medical oxygen to ease the shortage in hospitals. IATF gives the details why live. Yes, Iya, please go ahead.
Mariel, with the order of the Supreme Court, India's government has increased the oxygen supply to hospitals in New Delhi, the country's capital. The country's Supreme Court stepped in after 12 COVID-19 patients died last week at New Delhi's Batra Hospital due to running out of medical oxygen for an hour and 20 minutes. Also on Wednesday, 11 other patients died after an oxygen supply line malfunction incident in a government medical hospital in Chengalpattu happened. From the oxygen supply of 490 tons per day, the government raised the medical oxygen supply to 730 tons under Supreme Court's order. The government meanwhile denied reports that they are slow in the distribution of the donated life-saving medical supplies from other countries. Chairman of Defense Research and Development Organization, Dr. G. Satish Reddy, recently mentioned that oxygen concentrators, BiPAPs, masks, and other equipments from various countries have been received by DRDO and have been distributed.
As I said, from various countries like UK, UAE, US, and many countries, the equipment which has come. We have already distributed these concentrators in Delhi itself. Then we have given to Ahmedabad. We have already sent to Lucknow. We have already sent to Varanasi.
Government officials said the demand for hospital oxygen increased sevenfold since last month due to coronavirus crisis in India. The number of new confirmed cases on Thursday exceeds 400,000 for the second time since last month, and the health ministry reported almost 4,000 COVID-19 fatalities over the past 24 hours. Marielle?
Thank you for that live report, Iya. Families and relatives who were affected in the metro crash in Mexico demands an explanation for how the accident occurred and wants those responsible to be punished. Since then, investigations have begun to find the causes of the accident. Mexico City Mayor Claudia Sheinbaum added that Norwegian engineering company DNV will also help carry out a root cause analysis. President Andres Manuel Lopez Obrador has denied accusations made by an organization, Mexicans Against Corruption, for reducing the metro system's budget. With just weeks away from the Tokyo Olympics, Pfizer and its partner Germany's BioNTech announced that they have agreed to donate vaccines to competitors and staff at the Tokyo Games. Olga Chalian tells us the details live. Yes, Paul, good evening.
Hi Mariel. Athletes participating in this year's Tokyo Olympic Games will be commencing a vaccination program with Pfizer and BioNTech vaccines this month. They aim to be fully vaccinated with their second dose before starting the games when gates open on July 23. It was commented by the International Olympic Committee, IOC, on Thursday that this was made possible with the vaccine donations of Pfizer and BioNTech. Albert Bourla, Chairman CEO of Pfizer, speaks on behalf of the company, stating that they are proud to play a role in this program to inoculate participating athletes. The president of IOC, Thomas Bach, is in full support with the deal and encourages the athletes to set an example by being vaccinated when given the opportunity. There are a total of 11,000 athletes that are anticipated to participate in the Olympic and Paralympic Games. Back to you, Marielle.
All right, Paul, thank you for that live report. A 25-year-old Malian mother who was flown to Morocco has received or will receive specialist care as she gave birth to 9 babies. Dale De Castro reports why.
The story of a 25-year-old Malian mother, Halima Sis, made it to many news headlines when she gave birth to nonuplets, 5 girls and 4 boys in a Moroccan hospital after 5 weeks of stay. The mother was only expecting septuplets or 7 babies according to her ultrasound, so she was so pleased when she realized there was 2 more. Because of the nature of the mother's situation, all 9 babies were delivered through cesarean. The doctors from the Moroccan hospital had concerns about their safety as multiple births often end up prematurely and could face the risk of immature lungs, weak immune system, or even sepsis. However, according to Dr. Fantas Sibi, Mali's Minister of Health and Social Development, both the newborns and the mother are doing well. Ms. Sis's husband, Adjutant Kader RB, remained in Mali together with their eldest daughter and await for their arrival in the next few weeks. The family is overwhelmed by the amount of support they continue to receive, including a call from the President of the Republic of Mali. It is yet to be confirmed if Ms. Sis will make it to the Guinness World Record for the most children delivered at a single birth and break Nadia Suleiman's record in 2009 for giving birth to 8 children in California. Dale De Castro, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Mariela Tozal. Good evening.
And those are the reasons behind the news, May 7, 2021. I am Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.